Hello everyone, Dr. Tucker here. Let's talk about cholesterol drugs. They're called statins. And the question is, will you live longer if you're taking these cholesterol drugs? Now the first question you might have is, how does a chiropractor get involved and why is he concerned with cholesterol drugs? Well, we see a lot of patients who have muscle pain, cramping, and candidly sometimes we don't know the difference if the patient is having a side effect from the cholesterol drug they're taking versus something in their spine affecting nerve output causing muscular issues. So it's really hard to decipher once you start getting these chemical variables. But let's get back to cholesterol drugs and discuss the cost-benefit analysis. First is, do they work? And will they help you live longer? What are the risks and challenges? But let's start with a little background data. 1 in 4 Americans over the age of 45 are now taking a statin drug. Even though there's hundreds and hundreds of articles showing the significant risks, many patients are not getting that informed consent. They're just told this will save your life, take it. So they take it. They don't question, they go to the store, fill the prescription, and take it home. I guess the biggest question people should have is, will they add years to your life? So depending on the study you find, there's one out of England, and it simply said, statins will add a mere 3 days to your life. Now we've seen a few different types of these articles at this point, and depending on the surveys they've looked at, there's been research showing it could be 3 days, it could be 7, 14 days, but you might take 40 years of statin use with all the risks merely to get a few days potentially added onto your life, assuming you even believe that that was the cause of heart disease. So you got to weigh out the cost benefit. If taking a statin drug will give you 2 weeks more of life, but affect your quality of life for 40 years, that's a big challenge. Let's go to another article. Unfortunately, some docs don't even know this, but the FDA has come out and already made a stance about some of the major side effects. We know about liver damage. They've been testing that consistently. But by the time your liver enzymes are high, you've got problems. We know about muscle cramps. That's been ongoing because your body's getting depleted of your natural CoQ10. And actually, anyone who's on a cholesterol drug, if for some reason they choose to continue that path, they should mandatorily be on a CoQ10 because it is depleting that natural vitamin-like substance that we make. So what did the FDA come out and say? There's a new mandate for safety warnings for statin drugs due to the risk of memory loss, diabetes, and muscle pain. So if you've had your A1C level spike since you've been taking your cholesterol drug, that might be a direct correlation to that Lipitor generic brand name or whatever, that class of statin drug. A lot of patients might not be aware that their cholesterol drug could be causing diabetes. So let's look at cost. Per the Consumer Health Choices, generic drugs, as it relates to statins, could range anywhere from $10 to $12 monthly. But if you're taking a brand name, you might be looking at about $500 a month for your statin drugs. Forever, for the rest of your life, with no plan to get off. There's so many ways you can apply $500 monthly in your life, just merely as it relates to your health. So let's continue with a couple other studies. According to BMJ Open Study in 2015, the effect of statins on average survival in randomized trials delayed life 2 weeks. So again, going back to the fact that when they compare statin and placebo effect studies, there was not a significant change in longevity. Now, the next question is, what causes heart disease? Is it really a mere fact of cholesterol? What is cholesterol? And do we need it or don't we need it? So, cholesterol is a must to live. Cholesterol is basically a waxy substance that circulates in blood in a complex protein called a lipoprotein. Your cells need it. Your body obtains cholesterol from the food you eat or from cells that make it from raw materials. It is needed by every cell in your body as a component of the cell membrane it surrounds. So every single cell needs cholesterol. It's responsible for producing vitamin D. There's some conjecture now that statin drugs might be depleting vitamin D in patients. So if you're seeing a trend with below vitamin D levels and you are making an attempt to get outside and eat healthy, then it might be a direct side effect of that statin. Steroids. So cholesterol is the basic building block of all steroid hormones. This includes sex hormones, testosterone, made mainly in the testes of men, estrogen. So if you're taking a cholesterol drug and then your doctor diagnoses you with low T, well, you need cholesterol. So if you're lowering your cholesterol levels, your body's going to be deficient in the cholesterol it actually needs to have sex. Bile acids, compounds manufactured in the liver from cholesterol, are very important in allowing your digestive system to break down fats. So to break down fat, you need it. Cholesterol is not this evil thing. We can't live without it. There's an interesting article here on SOTT, SOTT.net. Heart surgeon speaks out on what really causes heart disease. Talking about how statin uses and implementations have been going on for years with poor outcomes. And in his experience as a heart surgeon, he had found that it's the inflammation in the arterioles occluding blood flow, not high cholesterol. So if the root cause is potentially not due to cholesterol, then the actual premise of lowering your risk for heart disease coming from a cholesterol drug is even managing the root cause. So I guess ultimately my suggestion would be research, weigh out the pros and cons, have candid conversations with your doctors, ask them to fill you in on some of the risks before you take any drug, let alone a cholesterol drug, and create a plan. If you're on a plan to have some sort of temporary reduction in some metric, then what is the long-term solution to get off that? Is it to be prescribed a painkiller, a cholesterol drug, or whatever for the rest of your life? Or is it to temporarily manage something medically and ultimately create a plan to get off of that so you're not on it for the rest of your life? So these are some considerations I hope you take. Any questions about some of the articles, feel free to email us and we'll forward along some links.